Hi everybody, welcome to Pediatric Emergencies, Chapter 34 in your EMT Basic Program. My name's Jessica, I'm the Program Director, and I'm going to run you through the introduction to this chapter. Assessing and treating pediatrics is very intimidating, it can be very scary, and fortunately for pediatrics we don't run these calls very often, but it also means that we're out of practice unless we're really thoughtful about how we interact with the kids in our lives and understand where they are in terms of their growth and knowledge and how to interact with them. It's really important that we make them comfortable because, again, we have to make sure that they're willing to give us information. If they are scared or if they don't trust us as a provider, we will not be able to obtain information from them like what happened, how did you fall, do you remember, etc., and we won't be able to effectively treat them. So let's move forward. We're out of this lesson goal, we're going to explain special characteristics of infants and children, and we're going to become comfortable and efficient in treating pediatric emergencies. Assessment and management of these patients, it really requires special knowledge. They are not small adults. Children require a special form of communication, and as I said, it's very trust-based. So you have to establish trust and understand where they are in development in order to do so. They're not small adults, and at the adolescent level, children do not like being spoken to like children. So it's important that we understand how to address each pediatric population and also effectively treat them using our EMT basic skills. We do have to modify our approach to pediatric patients to meet their specific needs. As I said before, only 4% of EMS calls are pediatric, so it's difficult to maintain that skill level. So it's important to remember that in EMS, you're constantly learning. So if you have an opportunity to attend pediatric-based training, do it. If you have an opportunity to interact with children in your life and just kind of learn about what's important to them, where they are in growth and development, ask them questions, see if they are able to have a conversation with you or if they clam up, that'll give you an idea as to how a sick child would engage with you as well. So what age is a child? You likely will be quizzed on this again, so make sure you know these numbers. A neonate is up to 4 weeks old. An infant is 4 weeks to 12 months. A toddler is 1 to 3 years. Preschool is 4 to 5 years. School age 6 to 12 years. And adolescent 13 to 18 years of age. Again, you will likely see that again. It's important that we understand how to visually acquire how much a child weighs. We also have tools in our industry to help us determine how much someone weighs based on their age and height. But it's also important that we don't rely on those tools in case they're not available. So these are two ways to determine pediatric weight. We would need this for medication dosaging. So it's important that we estimate it correctly. There's the 1, 5, 10, 10, 20, 30 rule, where at 1 year of age, they're approximately 10 kilos. At 5 years, approximately 20 kilos. And at 10 years, approximately 30 kilos. I prefer the age times 2 plus 8 equals their weight in kilograms myself. So an example of that would be a 10-year-old times 2 is 20, plus 8 is 28 kilograms. And that's about right. And you can see that it also kind of matches up with the rule above, but it's more specific. So please practice those in class. So let's look at facts about neonates and infants. They have a very limited ability to communicate. They're just learning how to thrive in the outside world. Their thermoregulatory system in their brain is not developed yet, so they lose heat very easily. At a small age like this, they often don't shiver, they just lose heat. So they're usually dressed warmer than we are for the weather, often rolled in a blanket or have a hat on, and are usually snuggling with their caregiver. They are nose breathers, so when their nose is congested, it's very frustrating for them and feels like they can't breathe. They definitely have stranger and separation anxiety, and the motor skills develop from head to toe and from trunk to extremities. So this is why if you don't have children, or if you do, it's so important when a child is able to raise their head while laying on their belly for the first time, or why when a child can grasp something and eat it. That's a milestone in their development. When they can crawl, that's a milestone. When they can walk, that's a milestone. So all of these indicate that they're neurological system is working, their motor function is working. And at this age, they don't have much of that. So you rely heavily on the parents and their instinct as to what's wrong with the child. So facts about toddlers, remember that this is 1 to 3 years old. They're very independent. They're walking. They're into everything. They want to touch everything, grab everything, often stick it in their mouth, sometimes stick it in their ear or their nose. They're very curious, and they have high degrees of separation anxiety. So when you're dealing with your pediatric patient, make sure that unless it's a highly critical situation, that you don't just run in and grab the child and take off, that you make sure that the parent or caregiver is within sight. And oftentimes it's nice to be able to assess a child of this age on the caregiver's lap so that they feel comfortable and they can see that the caregiver's interacting with you, so they should feel comfortable interacting with you as well. Preschool children have pretty good communication skills. So they're inquisitive. They're usually pretty cooperative. They have a need for modesty, so they don't like to be embarrassed. And so again, if you're going to assess this child of this age and you want to, say, lift their shirt to get lung sounds, make sure that it's in private with their caregiver present or a teacher present. They have lots of questions, and you should make sure that you're explaining all the procedures that you're doing and why you're doing them. School-age children have a pretty good understanding of their bodies. They can usually answer your questions effectively. Try not to lead this age, meaning, when you were doing this, that's how you got hurt. Make sure that they're telling you their story so that you understand exactly what happened. Because they tend to kind of want to be agreeable with authority as well, and they see you as a figure of authority. So let them talk. Ask them close-ended questions. This is an age where they develop the fear of hurting themselves, loss of blood, even mortality at this age. They start to think about these things. So make sure that they understand why you're there, and explain everything very thoroughly, and make sure that you feel very comfortable and confident when dealing with perhaps a broken extremity or blood loss or anything like that, that it's okay and that you're here to take care of that. And explain everything very thoroughly with this group. Adolescents are a hard group. They are in that development stage between childhood and adulthood. They want to be treated very independently. Let them make as many choices as possible. Communicate with them like you would communicate with your partner. Treat them with respect. They are legally still minors, and so anything that you do in any of these situations, you have to make sure that you're getting a hold of a parent, guardian, anything like that. Oftentimes if I'm at a school, they have paperwork that tells you how to get a hold of them, or they're already getting a hold of them. If it's a sports-related injury, similar process. But make sure that you're not just taking the kid and running without informing the legal caregivers. So that's a good start. Please know that there's so much to learn about pediatrics. I didn't know a lot of it until I had my own children. And so try to practice with healthy children, just asking them questions, learning about what they're interested in, trying to connect with them, because that will help you in those very scary times when you're dealing with not only a child, but a child who is sick or hurt. Do some reading on your own. Take any opportunity to get trained on pediatrics as much as you can. And please read the rest of your lecture and your chapter. And we look forward to hearing your questions. Thank you.